Welcome back to Two Doctors Homestead, here with my good friend Jason. He is an Army nurse and studying for his DNP.
Correct.
Got it right again?
Yep, got it right.
Excellent. Good friend. We met through the channel, which is super cool. He's local and you know, we hang out now.
Yep.
So we wanted to, as we did before, we want to talk about first aid equipment and what you know in terms of practical application of medical care.
Right. So we're going to go over a little more equipment than we did last time. We did a lot on circulation, bleeding, controlling bleeding, tourniquets, and then we're just going to go over some extra first aid items that are nice to have. Going into airway, so remember circulation, airway, breathing, that's where we're focusing on when we're approaching a first aid situation. So last time we did circulation, a little bit of airway. So are they breathing?
Breathing's important.
Breathing is important.
Number one, 3 minutes without air, rule of threes.
Right, you know, brain damage.
Brain damage is bad.
You know, become a Pennsylvania senator.
I was going to say, you can still get elected.
You can still
You're
do
still
things.
electable. With brain damage,
Absolutely.
you can still get elected.
So you want them to breathe. So they're either going to help them breathe on their own, or you're going to help breathe for them. So with CPR, you have things like the face mask. So this is to keep you from putting your mouth to their mouth.
Right.
All right. So a little seal. This one has a nice little strap on it. You just put it around the head.
Yeah,
I'm not actually going to do
it's
it.
all right. No, go ahead. I'll be the guinea pig here. We don't have to do the full CPR, though.
Right. Not necessary.
Not necessary. Not for this.
So you want to make sure that you have a good seal around the face, because every time you blow in some air, you want the air to go inside them.
Right.
You don't want it to go off the side.
Yeah.
It's a little more difficult
you
with
got
beards.
The beard, right. You can't stop and shave the beard.
Correct.
Right. You just push harder.
You could, it just takes longer.
Right.
But I recommend just pushing it harder.
Push it harder.
And
right.
try to get as much as possible. So if they have facial trauma, so say something hit them in the face and they're bleeding, baseball
teeth
bat,
are missing,
and it's just a mess, you're gonna want to avoid it. Okay. Unless you can put in advanced airway like an endotracheal tube.
Okay.
You're probably gonna do more damage.
Okay.
So if they're bleeding in their mouth, they're bleeding in their airway, and you just blow air down them, you're just gonna
push the blood,
all that blood.
Right.
If they got teeth in the back of your throat, you're gonna get teeth in the airway, and you can block the airway that way. So if you see a lot of trauma, I would just recommend not.
No. But what if they're not breathing?
If they're not breathing, then just do compressions.
Okay, do like chest compressions then.
Right. If their heart stops, if their heart is still going, what you can do is you can kind of do the little chin lift, and kind of let them open their way. I've also had it to where if they have a lot of facial trauma, like a blast, they'll actually lean over, and all the blood will be coming out their mouth.
Yeah.
And they'll open their airway that way, because all the blood will be going forward, and help them breathe on their own. So you don't want the blood going back, you want it going forward.
Right, that makes sense.
So now if they don't have a bunch of trauma, then you could use this.
Yeah.
Okay. Then there's also these things called MPAs. MPAs, they just kind of, if they have some, like their tongue is all in back and it's blocking the airway.
Yeah.
Sort of you going in there and holding their tongue.
Okay.
Okay. This will allow you, it goes in through the nose, and you're going to push it straight back. So there's a little wedge here towards the inside. And you're just going to go all the way back, and you're going to actually open up an airway from their nose to the back of their throat beyond the tongue, and so you're actually going to open up the airway and let them breathe that way.
Okay.
You can also use this with the MPA,
okay,
and that'll create an airway that you can air in and out of.
Yeah.
So these are all different sizes.
I was going to say there's different sizes, so how do you know, or does it really matter?
So it does matter.
Okay.
Because if it's too short, it won't go far enough.
Okay.
And if it's too long, it'll go too deep.
Okay.
So they're sized by measuring from your nose to your trachea. So turn here to the side here.
Yeah.
So here to here is where you're going to put it. So you take it out, you're going to measure it.
Okay.
This one's a little long, so you'd want a smaller one for you.
Okay.
So that's how you size them.
Interesting. And it came with a kit of different sizes, so theoretically you'd have a few.
You'd have a few.
You'd want to keep a few on you.
There's a few that are good for standard size adult. That one's for a really tall.
Is it?
Probably like 6.5, where they got a
big face.
Area, big face.
Giant.
And then they have smaller ones for children.
Okay. Okay.
So that's just something you want to look into.
Now, would you want to lubricate it, or are you just going in?
So ideally, lubricating will make it easier.
Okay.
So you had even some antibiotic cream.
Okay.
If you didn't have any Vaseline or gel, it will go in easier.
Yeah.
That's a fair point.
Now, would you be worried about increasing the blockage?
No. So
Okay.
this one, you're actually opening up because it'll go beyond. So beyond the tongue back, so you might have like a blockage if they're choking.
Right, if they're choking, yeah.
Right, you're gonna have it up here, and you're actually gonna go up beyond the choking if you can't get the choking.
Okay.
Like
now, would you breathe into the tube once it's there, or are you just gonna leave it?
So, ideally, this will open up the airway enough where they can breathe on their own.
Okay.
But you can breathe for them.
Okay.
With it.
So once that's in, you could use the CPR mask, and then you're forcing air into the tube.
Right. So you won't be up against a blockage. You're gonna because it'll go with the least resistance.
Excellent.
So you'll go past that, and you'll be able to breathe for them.
Yeah.
It's keeping with that 30 and 2, so 30 compressions to every 2 breathings if their heart is stopped.
Yeah.
Okay, so 2 breaths. And because they found out that it's more important to have blood circulating than it is to have the oxygen.
And the chest compressions, even if your heart isn't functioning, will cause it the blood to flow.
If the heart is still beating, you probably don't want to do chest compressions.
Right. Yeah.
But if they're not breathing, they have no heart beating, then yes, you want to do compressions, and that'll be the most important part for survivability.
Okay.
So say they had, like they're in an accident, and they say they're having trouble breathing, and you kind of see that they're struggling.
Yeah.
Right? If you happen to have a stethoscope and are familiar enough with how to use it, you can listen to their breath sounds. Like, so you put it on. This is a little cheapy one, so you won't have the best sounds.
Right.
Another thing to realize, if you keep these in a somewhere real long and you store them, the plastic will actually get hard.
And that is pretty old, so it might be.
And it'll crack. This one was sealed pretty good.
Okay.
But if it's open to air, it'll get brittle and it'll fall apart. So then when you go to use it and the piece falls off,
right, it's not going to work.
That's going to do much good.
So it's more about storage than best by date.
Correct. Right. How you store things
Mylar
is very
bag,
important.
oxygen absorber, desiccant packet.
Yeah, that'll all keep it for years on end.
Still be edible.
Still be edible.
Right.
Don't eat your stethoscope though. So, say you're using your stethoscope and you're noticing that one side is not as loud as the other.
Okay, so that's something. Yeah, I was gonna ask. What would you listen for? You put it on. You're putting it up to the chest.
You're listening for air movement. So when you put on, you're gonna notice a difference between the two sides if there's something wrong.
Yeah.
So you're just gonna hear that amplified.
Okay.
Right. And so you're noticing that one side of the lung. So say it's right side, you're not hearing anything.
Okay.
But you hear stuff on the left side.
Yeah.
So that's where there's something that's wrong with that side of the lung.
Yeah.
So it could be compressed, damaged. You have a pneumothorax, which is air. Hemothorax, you have blood in the lung, and it's causing the lung to collapse.
Yeah.
Okay. So things like a needle decompression, they're not used as much anymore because they tend to clot pretty quick, but it'll give you a little relief.
Yeah. Okay.
So between the second and third intercostals, you're going to feel
one
down.
somewhere. We have a chest decompression needle here.
You're going to feel for the ribs. You're going to find the space between the ribs. So you have your collarbone. You're going to go down 2 ribs from there, about middle, and you're going to sink it.
Yeah.
All right.
Yeah.
And it's a little needle. It's going to open up, and that's going to let the lung expand.
Okay.
And that will help out short term.
Yeah.
The definitive treatment for that is a chest tube.
Okay.
So surgicals have to put a chest tube in. It's going to empty out air and let the lung re-expand. But that's more advanced than what we're looking for right
it's
now.
more than first aid. That's second aid. At least second or third.
At least second or third aid. Trauma shears are a great tool because say you have an injury somewhere and you want to access it and the clothes are in the way.
Yeah.
You got to cut them off. You got to access the site. You want to see what the damage is.
Yeah.
This is a pretty standard set of trauma shears. Very just scissors with more teeth.
Yeah. Yeah.
Cut through jeans.
And it's got kind of that flat end, so you can slide it along the body.
Yep. So that'll help guide.
Yeah. You're coming
You're not going to cut the person.
Right.
So just get under and just hold.
Just chop.
Chop.
Right.
There's a couple other, like this one. It's a Leatherman Raptor.
Oh, nice.
Folds over. And
it's full set of shears.
full set of shears.
Okay.
It has ability for cutting of a seat belt.
Okay. Okay.
And then on the back, it has a ring cutter.
Oh, really? So if you've got, say, a finger injury, your ring is crushed.
Right. So
Okay.
not
All right.
as big of a problem with the
With
silicone
this, right? I know.
rings,
I noticed we both have the silicone rings. Not too big a
but
deal.
gold,
Okay.
stainless.
Interesting. So you would actually get that in there and cut the ring off.
So yeah, because if
Yeah.
you have a crush injury, you got hit on something
Yeah.
and your finger starts
Yeah,
swelling,
Right.
your ring was going to act like a tourniquet,
Yeah.
and that's
don't
not
lose
the
the
tourniquet
finger.
you want.
Right.
Right.
Right. Right.
So one of the ways is to use the ring cutter, and we're
Yeah.
just going to cut it off.
Okay.
There's a couple other ways you could use with like dental floss or string,
Oh, I've seen. Yeah, where you kind
Wrap
of try
it
to
real
wrap
tight.
it around and try to pull it.
and that's a neat trick.
Yeah.
And all if you can't get to a ring cutter,
Yeah.
I like the wrap because it's easy.
Yeah.
You know, you just fold them up, push buttons, clamp it up,
I
and
like
it
that.
goes in.
Now, who makes that? You said
Leatherman.
Leatherman. Okay. So it might actually be a good addition to your first aid kit.
Yeah, and it comes with this little
Little case.
Kydex
Does it have a
Off-road.
knife as well? What do we got? Let's show the tool here.
tool. So it does not have a knife other than the cutting tool for the scissors.
Okay, so it has the scissors.
So
It's got the seatbelt cutter. That's
scissors,
great.
seatbelt cutter.
And then, all right.
So very
Christmas
cool.
is coming up.
Christmas is coming.
Right, good Christmas gift idea.
BVMs. We don't have bag valve masks. So like
Yeah, I
you see
do
in the
not
hospital,
have that.
and essentially it's a bag that attaches to the mask, and it's going to do the breathing. Instead of you having to breathe, use your lungs, you just use the bag.
Yeah.
Don't necessarily. Not everyone's going to put that. It's large. It doesn't go
Right.
in kits easily.
Okay.
It won't fit in
Not
any of
easy
these
to carry
bags.
around.
It's cool for the car,
Okay, okay.
but for just carrying around,
Right,
it's a
you
little
want to
more
have your little
difficult.
baggie of goodies, and that's
Yeah.
not going to work.
If you had a backpack
Okay.
or a larger kit, you can do
Yeah,
that.
Yeah.
Or say that we'll move it on. We'll move on.
Yeah.
These are cool little devices. So this is a splint maker.
Yeah.
So say you roll your ankle while you're out hiking. You can actually use this. It folds out. It's moldable, reusable, and you just put it on, and then you use your gauze, tape it on,
Right.
and you got yourself an ability to have a little real splint, real nice, and then
You just roll it back
just
up.
roll it back up. You need it. So they're a little bulky, but
Yeah.
they're nice if you have a larger kit
Right.
and you have somebody that's prone to rolling their ankles.
Ankles, maybe
Kids.
broken arm, broken leg.
You
Or is
can
that not-
stabilize.
Okay.
You will not be able to set it probably in the
Okay.
field, but
Right.
if you want to immobilize it, this is a great way to immobilize it.
Okay. Okay.
So like you break your wrist
Yeah,
or your
right.
forearm,
Yeah.
you know,
Bone sticking out.
bone sticking out.
Do you push the bone back in, or is that going to be a different video?
So you can, but you got to be careful because you could damage a lot more.
Just jamming the bone back in.
Yeah, so you have, like say you
Yeah.
have your forearm, you
Right.
got your arteries and your veins inside it.
Yeah.
So if you broke your arm
Yeah.
and this is sticking out, you have a big risk. So if you're pushing it back in
Right.
and you end up grading an artery,
Yeah.
then you just cause yourself another
It's just
issue.
a lot worse.
Yeah.
Yeah.
If you pull on the arm
Okay.
and gently kind of push it in,
Yeah.
that'll help reduce risk for infection.
Okay. Okay.
Because a bone sticking out, it's not the most
Right.
clean situation,
Right. Right.
especially if you're out and about.
Zombie apocalypse.
Zombie apocalypse.
Yeah.
That's just calling the meal bell for them.
Right. Right. Blood squirt, and they smell that stuff.
They're coming for you.
Yeah.
So
Okay.
something fun to do. Gloves again. If you're doing
Once you get the
anything,
gloves,
use
yeah,
the gloves.
yeah.
It's essential. If it's dark, cool things to have.
Right. Right.
Flashlights. Handhelds are fine. I would also recommend maybe a head one.
Headlamp. Yeah.
Headlamp.
We could grab a headlamp. Yeah. We got the headlamps.
Stick that in. 'cause-
Hands free.
Exactly, hands free. So if you're using this and you're on it, you're trying to do stuff versus having one in your head.
Right.
Two hands are better than one. Another cool option: chem lights. Not the brightest light, but they'll give you enough light to work by. Your eyes will get used to it. And then also for emergency situations, if you're on the dark road and you throw some of these out as a signal,
Yeah.
those are always nice.
All right. You wanna call it there?
All right, we can stop it on.
All right. Once again, guys, I want to thank Jason for joining the channel. real Army nurse. And we, as always, we appreciate you for watching. We're gonna keep going. We're gonna do a couple of these, I think.
Yep.
So we appreciate you guys for watching. Thank you.
Have a good one.